What is a widowmaker?
So there are three arteries supplying the heart. One of the artery, which is a major artery, which runs in the front of the heart.
Welcome back, viewers, to Faith and Discipline podcast. Our guest today is Dr. Amir Ayub. He is a consultant cardiologist. Welcome, Dr. Ayub, to Faith and Discipline podcast.
Thank you very much.
What is coronary artery disease?
Coronary artery disease is simply the thickening or the blockage of the coronary arteries. The arteries which supply the muscle of the heart, if they become narrow or if they get blocked for any reason, that is called coronary artery disease.
Why does coronary artery disease form in the arteries?
There can be multiple reasons. One is genetic. So you are genetically predisposed. It's a familial disease, as you know. It can travel in families. There can be a racial. For example, Asians are more predisposed to coronary artery disease. So there's a genetic link for that. Then again, it's mainly the deposition of cholesterol, the bad cholesterol in the arteries of the heart. And that can be due to either your eating habit or simply because your body is producing more cholesterol than usual.
Okay. What age this plaque start to build up in arteries?
Well, it will be very interesting for you to hear that I did my MD thesis on this coronary artery disease, and the earliest detection of the coronary artery disease in the Egyptian mummies have been found to be as early as 4 to 5 years old. So, but for practical purposes, in patients who have family history of coronary artery disease, their coronary artery disease can develop as young as in the age of 20s and 30s.
What are the risk factors that contribute towards the buildup of plaque in the arteries?
Let's divide them into different groups. So the first is the genetic predisposition. For example, if you are an Asian, then being an Asian is a risk factor of coronary artery disease. Secondly, if you have a family history, so if your parents or brothers or sisters and grandparents have coronary artery disease, not necessarily, but it is likely that you will develop. So family history is one. And after that becomes your body lifestyle. So are you somebody who is overweight, who is not into much of an exercise, who eats not sensibly, a lot of fat, greasy things, especially the Asian foods, as you know, they are rich in fat. And if you use the local oil, the ghee as we call it, so that's very injurious. So the food is again a very important part of coronary artery disease, especially as we come to the Asian side.
Okay. So is it, would you call it the disease of only for the Asian background or is it for Caucasians?
It's a holdover. What I'm trying to say is that being Asian is a risk factor and we have to be a bit more careful. But even in Caucasians, worldwide, it is one of the top few killers, the coronary artery disease. So it is Asians, the reason I'm mentioning is because it is one of the very important risk factors and we Asians have to be very careful as compared to Caucasians when it comes to coronary artery disease.
Okay. How serious coronary artery disease can be?
It is very serious. It is something that has to be taken very seriously because it is a cause of, and coronary artery disease is related to sudden death as well. So you can imagine how important it is that we look after ourselves and make sure that we pick up the early signs of coronary artery disease.
Other than heart attack, does it have any link to strokes?
Indirectly, yes. And when you have coronary artery disease, then it's likely you will develop thickening of the arteries elsewhere as well.
What is a widowmaker?
This was the term used many years ago when we did not have the advanced investigations. So there are three arteries supplying the heart. One of the artery, which is a major artery, which runs in the front of the heart, which is called the left anterior descending artery. That supplies the major pumping action wall of the heart. And if that gets blocked for some reason, that can cause sudden death. So that was called the widowmaker, the artery. But nowadays, because we are picking up symptoms very early, we are investigating them, this term is now no longer as popular as it used to be.
Okay. I just asked this question to make people aware because there is a misconception. People believe because there are three major arteries supplying blood to the heart, so if the patient can survive 3 heart attacks. So 1 heart attack is 1 artery and 2 and 3. So for that reason.
I think this is a misconception.
Yeah.
1 artery, for example, the artery which runs in the front of the heart or the artery which runs in the back of the heart one artery can be fatal. So that is why I don't think it is true that you can have 3 heart attacks. Even one can be very serious.
Are there any indications that can indicate for the disease to be there before it starts showing its hallmark symptoms, for example, angina and dyspnea?
Yes, I think what we have to do is to look for things like if you have an unexplained shortness of breath, you have pains across the chest or left side of the chest. For some reason, you're getting pain in the arms or any numbness of the arms, or your arms feel heavy, or for some reason there's a sweating if you feel. And I think all these symptoms you should be aware of. And if you have these symptoms on a more than once, then you must seek medical advice.
Okay. Well, diabetic patients, not all of them can experience angina pains, and all of a sudden they might become a victim of a heart attack. So for those, they want to know, are there any kind of indications they need to be aware of? Okay, if that happens, which means they can be a victim of heart attack or coronary artery disease, so they need to change their lifestyle.
I think this is a very important question, and for the diabetic population, where the diabetes in Asians is an epidemic. I think what the diabetics need to learn is that if, for example, they get any unusual shortness of breath, sweating. Now, sweating can be very confusing, because even if they have low blood sugar, that can cause sweating. But I think if their blood sugars are being maintained and they know that their blood pressures are okay, and if they're getting unnecessary sweating, then I think they should seek medical advice. They may not have the classical chest pains, as you very rightly said, but they should look for any untoward thing, which is a new symptom, like shortness of breath, sweating, or tingling, or numbness in the arms and stuff like that. They should seek medical advice.
Okay. How it is diagnosed? Like if a patient comes to you, how do you diagnose the patient definitely have coronary artery disease?
So we have different protocols. So if you come to a cardiologist, mostly you'll be referred by your GP, and you see a cardiologist like myself. I have different ways of diagnosing, and we follow a protocol, which is protocol followed all over the world. That we do, for example, non-invasive tests, which can include the stress echo, the myocardial perfusion scan, or the CT coronary angiogram. All these 3 are non-invasive, and we can request any of these depending on which hospital you go and where the facility is. Any of these tests, which are non-invasive, will pick up coronary artery disease. Once we diagnose you as a coronary artery disease, obviously you get started on treatment.
Would you briefly explain what these tests are?
So, for example, there's a stress echo, and the stress echo, what we do basically is an ultrasound scan of the heart, but it is done in 2 phases. One is that when you are lying on a couch at a resting position, and then with either you are on a bike or with a chemical drug, we increase your heart rate. And then we take images when your heart rate is beating at 140, 150 beats per minute while you're lying on the couch. And we see the difference between the two. And if there's any wall of the heart which is not moving well, we know that wall of the heart is not getting the blood supply. And so it's an indirect way of checking. Same is the nuclear scan, in which we inject radioactive material, and that can pick up during the rest and when you are stressed, like increase in the heart rate. CT coronary angiogram is a bit different, whereby we simply you go through a scanner and we pick up the arteries, but without putting any catheters in, it picks up any disease in the arteries. So all these things are where we don't put catheters in the heart like an angiogram, and they are non-invasive, and they give a very good accuracy level.
All right. Thank you. What are the treatment options available?
So when you are diagnosed with coronary artery disease, if it is a mild coronary artery disease, which is picked up in the early stages, as it is being fortunately done nowadays because the public awareness is great, we put you on the medications. Now, if, for example, we find that during these tests that any of the artery is very tightly narrowed and you're getting symptoms, then we send you for what we call an angiogram, and then if it is confirmed and then a narrowing is tight, then they put a stent in there to open up the artery.
Okay.
And the third option is if the more than 2 arteries are involved, so all 3 arteries are involved in different levels, then the ideal treatment is the bypass surgery.
Okay. So what is the success rate of an angioplasty?
The angioplasty, when done in competent hands, has a success rate of more than 90%. So whenever we open an artery, it is fully opened and we get 100% flow through the artery. And therefore the success rate you can say is between 90 to 100%.
90%, okay. How do a clinician decide whether angioplasty or bypass operation is more suitable for a patient who suffers from CAD?
So there are multiple trials that have been done on these two, both in America and in Europe. And the conclusion is that if there's a single artery involvement, for example, the left anterior descending, the widowmaker we are saying, that will be dealt with a stent. Okay. If there's a couple of arteries involved, even then we can do stents in one artery and the second artery. Okay. But if, for example, all three arteries are involved and on multiple sides, then the results of the trials show that the bypass surgery over the long run is the best option. Okay. So it all depends on what we see on the angiogram. One or two vessels, we go for angioplasty. If all three vessels are involved and on multiple sides, then bypass surgery is ideal and gives the best results in the long term.
Okay. If the patient has three arteries blocked, still you can do a staged operation, angioplasty, where you could put stent into one artery and wait a couple of months and treat the other one.
This is what we call a staged angioplasty, which means that, for example, if for some reason, let's say the patient doesn't desire bypass surgery and say, I don't want to have, or for any reason, the patients have other conditions like kidney failure or all that stuff and everything, where bypass surgery may be considered high risk. In those situations, we pick up we'll take one artery, stent it, then we will take after a month, we may call the patient back and do a second one. But again, then if it is very diffusely diseased, for example, there are long segments of artery which are diseased, then the stenting may become difficult at that stage.
Okay. Is age can be a factor to decide whether CABG or angioplasty more suitable?
We don't take into account, we take into account more the physical fitness of a person. Okay. So you will have, for example, we have patients here who are 84 years old playing golf. Very active, and those patients have undergone bypass surgery. No. However, if a similar patient comes across and he's not that mobile, we assess the quality of life, the QOL. So if the quality of life is such that the patient is not able to do much, other conditions are there, then obviously the angioplasty will be preferable. Okay. Because bypass surgery in those cases will be high risk surgery.
How can we prevent coronary artery disease?
Well, it's $1 million question. Best thing, prevention. Look after yourself. If you have a family history, if your parents have had coronary artery disease, your elder brothers have had, look after yourself at the age of 35, 40, get your cholesterol checked. Make sure you're not overweight. Do regular exercise. Be good in your diet. Make sure that you have a healthy diet. By healthy diet, we know all what we know. Don't take too much of fatty food or greasy foods. And avoid smoking, avoid alcohol, and have plenty of sleep. You must have at least 7 hours of sleep, which is very important for heart. And I think all these lifestyle modifications you have to make.
And other than the lifestyle, what about stress?
Stress has been identified as one of the contributory factors of coronary artery disease. It acts indirectly. So it has been shown that a person has to have in the very stressful situation for at least 3 to 5 years before he will develop a coronary artery disease of any significance. But because what happens is with the stress, your blood pressure goes up. When your blood pressure goes up, it puts an added stress on the arteries and on the heart. And that is how indirectly the stress contributes.
Okay. And there is kind of misconception. Some people believe there are people out there who eat unhealthy diet, who've been smoking all their life, and they are perfectly fine. And this information, doctor normally advise you not to eat unhealthy food or stop smoking, this and that. So they just take with a pinch of salt. They don't take seriously. So what would you say to that?
I think I would say to them is that don't take the risk. It's a very expensive risk to take. If somebody hasn't had a heart disease and he has been a smoker, he may be just one percentage of people, obviously, in whom it did not affect the arteries. But why would anybody be willing to take such a risk that continue to smoke simply because his friends used to smoke and didn't have anything, so you won't have anything? I wouldn't advise that.
Okay. Many thanks, Dr. Ayub, for the information provided. I believe the information provided, our viewers will find it very useful.
Thank you very much.
Many thanks for watching this episode. If you found this useful, please share with your family and friends. If you haven't already, please make sure to subscribe to this channel. Thanks for watching.